The next condition that increases a person's chances for getting a heart attack is high LDL levels. LDL means bad cholesterol. It's a long name, you need not remember it. It's called low density lipoprotein. You need not remember it. If the LDL levels are high, your chances of getting a heart attack are significantly increased. If the LDL is normal, those chances of getting a heart attack are decreased. Those people who have high LDL, in the past there was no treatment available for them except for dietary control and exercise. Today we have various types of tablets which can very effectively control the high LDL level. They are given in addition to dietary management and exercise. Tablets alone are not a good idea. They are always combined with dietary management and exercise. And once the LDL is normal, your chances of getting a heart attack because of high LDL are significantly decreased. Now, the question comes as to what are the normal levels for your LDL? How much should be your LDL? And this is where you have to focus on something very important. I spoke in the beginning of this presentation that you should know how many cardiac risk factors you have, because depending on the number of risk factors, you will be told by your doctor that this is the goal for your LDL level. So if you have, say, 2 or more cardiac risk factors, then your levels will be different. Your expected optimum levels will be different compared to if you have no cardiac risk factors. So suppose you are 45 years old, you have no cardiac risk factors, then your LDL can be normal, say if it is below 130. But compare this to if you have 2 or more cardiac risk factors, then your desired LDL level goes down to 70. So in some cases below 100, in some cases as low as 70. Why the difference? The difference is that it was seen that people who have more risk factors for getting a heart attack need to be treated more intensively to decrease those chances. Now, there is a general tendency to think, oh, I don't have any risk factors. No. Remember, I talked a few minutes ago that if you are a male, that is a risk factor. So all males already have one risk factors the day they were born. If you are over 55 years of age and a man, you have 2 cardiac risk factors. If you smoke, you have 3 cardiac risk factors. If you have blood pressure, you have 4. So the number can very easily go up. But remember, 2 or more cardiac risk factors is a condition that should be treated aggressively and should not be neglected. Towards the end of this presentation, we will give you a list of cardiac risk factors, see how many you have. You will need to get some numbers to get that right. But in the end, you will benefit from knowing how many cardiac risk factors you have. Now, where does LDL come from? It's a long discussion, but it comes from various foods which are rich in fats. It also comes from carbohydrates. It also comes from inactivity. There are many risk factors. It also comes from alcohol. There are many factors that increases LDL. We have almost 3 hours worth of presentations on various types of cholesterol, what they are, how they affect you, and how to control them. Please listen to them. The other risk factor is a low level of HDL. There are basically 2 types of cholesterol. There are more, but 2 are important. One is called LDL, we talked about it a moment ago. The second is called HDL. HDL is called high density lipoprotein. You don't need to remember it, but it is called HDL or good cholesterol. Why is it called good cholesterol? It is called good cholesterol because if the levels of this cholesterol are high, then it decreases your chances of getting a heart attack or a stroke. Now the normal levels vary between men and women. The higher the level, the better it is. The levels range from 35 to 85, and as I said, higher the level, better it is. HDL levels can be increased only by physical activity. As of today, there are not medications available to increase the HDL level. So if your HDL levels are low, the only way to increase them is through physical activity. Physical activity includes walking, includes more aggressive physical activity, but make sure that you have talked to your doctor before you start any exercise, because if there is a decreased circulation to your heart, you can end up getting a heart attack by vigorous exercise. So be very careful about it, but in the long run, over a few months period, you can gradually increase your HDL levels by increasing the physical activity. We have another 3-hour presentation on physical activity, how to increase it safely. Please feel free to watch that, but I emphasize again that before you start any increased physical activity, talk to your doctor and ask him as to how much exercise you can do. I have not seen you, I don't know how much exercise you can do. Your doctor knows that. So ask your doctor as to how much exercise you can start with, what type of exercise you can start with, and how to build on gradually that you can increase your HDL over a period of a few months and then keep it high. As I told earlier, the question always comes as to how much should be my HDL level, and the answer is higher the better. There are some drugs that are being tried to increase the HDL level, but none of them is good enough in raising the level without causing any harm to your body. Follow what I say. There are some medications that are being tried to increase your HDL level, but as of today, there is no tablet or medication available that will increase your HDL level without causing a harm to you. So the harm from these medication is more than the benefit they provide by increasing the HDL. But maybe 2 years, 5 years, 10 years down the road, there will be tablets or medication available to increase the HDL. Till that time, we have to rely on increasing physical activity. Remember, increasing physical activity also decreases your blood sugar. So even if those tablets come that can increase your HDL, exercise has additional benefits. It decreases your blood sugar levels, it decreases stress, it makes you sleep better. So there are so many other things that come with increasing physical activity. So again, increasing physical activity is a wonderful idea. Talk to your doctor and follow his or her advice in continuing increased physical activity. Another risk factor that can be modified is smoking. Those people who either smoke or use tobacco in any other form, inhaling it, chewing it. In some countries, there is a very bad trend about chewing tobacco. In countries like India, there is pan parag, and it's actually common in whole of Southeast Asia that people feel better chewing tobacco because there is not a stigma of smoking, but it's as bad as smoking. So because it increases chances of causing a heart attack. Smoking causes many problems. Not only it increases your chances of getting different types of cancers, it also increases chances of you getting COPD, a condition where you can't breathe very well. When it comes to heart, smoking significantly increases your chances of getting a heart attack. Smoking also increases your chances of getting impotence and peripheral arterial disease or PAD, where the vessels to your legs are blocked, and because of that, in many cases, the leg has to be chopped off or cut off, amputated. Coming back to the heart attack, smoking is a very important and very major cause of predisposing a patient to a heart attack. It's not easy to stop smoking. We have a presentation which is an hour long. Watch that to know the details. Here I will only say a few things. Most people who try to stop smoking are not successful at the first attempt. people need at least 3 to 6 attempts before they stop smoking permanently. The second thing is, there are two ways people stop smoking. One is going cold turkey, means you suddenly stop smoking one day and never smoke again. This type of approach leads to a lot of symptoms, lot of discomfort, but some people prefer that way. Some people can tolerate it. They feel strong after that. So that is one way. A second way to stop smoking is to replace the nicotine in the cigarettes by medication which has nicotine. Why people enjoy smoking? Because smoking has nicotine in it, and nicotine causes some sort of a relaxation to the body. And when the person stops smoking, the opposite happens. And these symptoms can be very troublesome to the patient. So to minimize those symptoms and to increase the chances of success in stopping smoking, your doctor can give you a patch with nicotine, chewing gum with nicotine, nasal spray with nicotine, or some sort of tablets to make you stronger to fight those symptoms of withdrawal. But if you smoke, you tremendously increase your chances of a heart attack. So smoking is a cause that can be controlled, and chances of a heart attack decreased.